Sexual Health Unwrapped, the ins and outs. A 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.
Hello, welcome to Unity Xtra. You are listening to the Sexual Health Unwrapped, the ins and out. My name is Oyin. The ins and out of sexual health are important. So it's important to say something to someone who is a trusted professional. Sexual health and relationships matter. We encourage early and regular testing, as data shows that the most common contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. But that is why it is so important to go and get tested, because you can have no symptoms and still be infectious and pass an STI to your sexual partners. Condoms are the best way to protect yourself against STIs, and they can also protect against unplanned pregnancies. Haringey have a free Pan-London campaign. Come correct. Once you register, you can access free condoms across London, wherever you see the sign Come Correct in the window. Please go to your local pharmacy in Haringey. So tonight, the focus of the show is reproductive health and long-acting reversible contraception, popularly known as LARC. Joining me is Dr. Rachel DeSouza, consultant in sexual health and reproductive health. Thank you for joining me, Rachel. Let's start off by, how are you doing, first of all?
I'm good. Thank you for inviting me. It's great to join you today.
It's great to have you. Tell me, what's like a normal day like for you at work? What does it look like in the clinic?
Oh, I don't think there's any such thing as a normal day. Every day is different. Every clinic is different. Usually they're very busy with people from a mix of backgrounds. Some people come very anxious, but hopefully we are able to reassure and help them and they leave happy. So a mix of people coming for STI tests or treatment for infections, or wanting contraception or needing emergency contraception. And it's great. I love working in our clinics.
Yeah, I love that. I mean, you guys deal mostly with like sexual health and reproductive health. For someone who might be listening who has no clue, someone who's never heard of it before, can you just explain in layman's terms what is sexual and reproductive health?
So good sexual and reproductive health is a state of being well in all matters relating to the reproductive system. So not just physically, but also mentally and socially. So sexual and reproductive health includes helping people to have a satisfying and good and safe sex life. It also involves having access to good contraception so that people can choose when they want to try and have a baby. And it also includes helping to protect people from STIs and to treat any STIs they get. So it's a whole mix of things, and it's not just about when we're unwell, it's about good sex health.
Yeah, that's brilliant. I mean, what would be like the key messages? Because we're targeting mostly young adults, open to everybody, of course, but what would be the key message for young adults, particularly in the Council of Haringey?
So I think my key message would be, if you're having sex, make sure that you're using effective contraception, unless, of course, you're wanting to get pregnant. And also make sure you use condoms to help protect against STIs. And the other key message I'd say is to only have sex when you feel ready. So don't feel pressurized by anyone into having sex that you don't want, or just because your friends are saying that they're having sex. Have sex only when you want it.
No, I think that is so key. There's a story that's going around on social media at the moment about a young lady who unfortunately contracted HIV from her first sexual experience. And I don't know how that whole thing went down, but I think those key messages are very, very important to continue to push out, because some people might think it's outdated, but actually it's incredibly relevant. I mentioned earlier in the show that condoms are one of the ways to protect against STIs, but it can protect against unplanned pregnancy, but it's not the only way. Can you tell me a little bit about long-acting reversible contraceptives and what that is?
Yes, so they are methods of contraception, so stopping you from getting pregnant, that don't rely on you remembering to take or use something for them to be effective. So they're highly, highly effective. They're much more effective at preventing you from getting pregnancy than just using a condom. And there are really 3 different types. So there's an IUD or coil that's put inside the womb and can last up to 10 years if you want it to. you can have it taken out sooner if you want as well. And then there's an implant that's a sort of matchstick size rod that's put in your arm, in the upper arm, and that lasts for 3 years. And there's also an injection that you can have every 3 months, and you can actually give that injection to yourself as well. So you can take the injections home and give it to yourself. But those are the long-acting methods.
I didn't know about the third one. I'd never heard about the injection part before. The fact you can give it to yourself. Does it actually work though? Like, do these 3 options work?
Yes, so they're
how
all
do
really,
they work,
really effective. So how they work is the implant and the injection, they both work in a similar way by they stopping you releasing the egg each month. So the woman normally in their cycle will release an egg halfway through between the periods, and they stop you from doing that. So they often also stop you from bleeding, but you can get some irregular bleeding with them. And the IUD or the coil, they work usually by stopping the egg and the sperm from getting and meeting. So they usually stop the egg from fertilizing, but occasionally they can work if the egg does get fertilized by stopping that then implanting in the lining of the womb. So all of them very, very effective.
Yeah, I mean, it sounds like it. What would be like the advantages and disadvantages? Because like with everything else, besides maybe like condoms, there are some advantages. Can you let us know what some of those are with LARC?
Yeah, so I think the big advantage is that they are very effective and you don't have to remember to do anything. So it doesn't interfere with sex at all. You don't remember to take a pill each day and worry if you've forgotten a pill. But also they're completely reversible. So unlike being sterilized, which is really permanent, although it can be reversed, with any of these methods, if you choose to stop them, they can stop you. Obviously, you have to go to a clinic to have the implant removed or the IUD or coil removed, but that can easily be done.
Do you think, and this is like a side question off of the back of what you mentioned, that LARC, for example, can affect fertility when someone stops using it, as an example?
So the only method that affects fertility when you stop it is the injection, just because the injection can stay in your body. So it can take up to a year for that to get out of your body. But after that, it doesn't affect your fertility, and none of the other methods affect your fertility in the longer term at all.
So which one would you say is the most effective of all the 3 methods that you mentioned?
So the implant is probably the most effective, but the IUD or coil, they come very closely behind that.
In terms of, obviously, these are options that young people in Haringey and all of the councils can have access to, but how can young people specifically in Haringey, how can they access LARC? What options do they have?
So we have clinics. We have 2 clinics in Haringey. One's at Moreham House in Wood Green, one's in Lordship Lane. And both of these clinics are for anyone under the age of 25 with any sort of STIs or contraception concerns, but for any woman of any age if she wants to have a LARC method of contraception. And you can find out more about these on our website at www.sexualhealth.cnwl. And then go to the section on Haringey Young People Services, and you can that will show you how to book an appointment. We do have walk-in clinics as well, so at Moreham House on a Thursday between 4 and 7 p.m. and at Lordship Lane on a Tuesday between 4 and 7 p.m. But people can also go to their GPs and access LARC through their GPs if they want to do that as well.
Okay, so fair good options. I feel like that's a really good place to stop and take a quick musical break, and then we're going to come back and speak more about sexual and reproductive health on Sexual Health Unwrapped, the ins and outs on Unity Xtra. The ins and outs of sexual health are important, so say something to someone who is trusted and a professional. Sexual health and relationships matter, and we encourage early and regular testing, as data shows that the most common contracted STI by young people are chlamydia and gonorrhea, which both of them can be asymptomatic, and that means you have no symptoms but they're still infectious and you can still pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs, and they can also protect against unplanned pregnancies. Haringey have a free pan-London condom scheme, #ComeCorrect. Once you register, you can access free condoms across London wherever you see the Come Correct sticker on the window. Please go to your local pharmacy in Haringey. We'll be right back.
Sexual Health Unwrapped, the ins and outs, a 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m. where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.
Hello and welcome back to Unity Xtra. You are just listening to Hide and Seek by Stormzy. It is a lovely Wednesday evening and we are talking about Sexual Health Unwrapped, the ins and out radio series. And today we are talking about reproductive health and LARC with Dr Rachel DeSouza, who is a consultant in sexual and reproductive health at CNW Sexual Health. Our key messages are the ins and out of sexual health are important, so say something to someone who is a trusted professional. Sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but they are still infectious and you can pass on STIs to your sexual partners. Condoms are the best way to protect yourself against STIs and can also protect against unplanned pregnancy. Haringey have a free pan-London condom scheme, #ComeCorrect. Once you register, you can access free condoms across London wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey. So we have a few questions which were sent in by young people who live and work and study in Haringey. So I'm just going to go through that as a rapid fire questions, because I know these are like the burning questions they want to get to. So the first question we have is, at what age can a young person get prescribed LARC?
So any age, from when you're thinking about having sex, ideally, before you actually start having sex, it's good to have a LARC method. We do ask additional questions if someone's under the age of 16, just really for your own protection, if you come into one of our clinics, but we welcome anyone of any age.
Would someone, for example, under the age of 16 need parental consent?
No, really good question. So no, we ask you about who else is around in your life. We ask you about the age of your partner and that sort of thing. But as long as we're happy that you understand the advice that we're giving and we think it's in your best interest, no, then we can give you a LARC method without your parents or your guardian knowing about it.
Okay. Do LARCs protect against sexually transmitted diseases?
No. That's a really good question. And so that's why when you have a LARC method, we encourage you also to use condoms as well, because the condoms will then protect against STIs, not completely, but they're very good at doing that. And condoms do also protect against getting pregnant a little bit, but they're not nearly as good as the LARC methods, and they break. Or that you forget to put them on. And so the LARC methods are great because you've got them there. You don't have to worry about that. And you just use a condom as well, particularly if you're with different partners, but also you don't know what your partner is getting up to. So get them to use a condom as well.
It's like a protection on both fronts, isn't it? Another question that we received is, how effective and safe are LARC for teenagers, even if they haven't had a child previously?
So they're just as effective whether you've had a pregnancy before or not, and they're very safe. So even if you want to have an IUD or a coil fitted, that's completely fine when you've not been pregnant before. Yeah, we fit lots of devices in people that have never been pregnant before.
So if someone, for example, has not been sexually active and they wanted to use the coil, for example, that's something that would be internal. What would be the process of that like? Is it?
Yeah, so it's a good question. So we would need to examine you, and we would need to put in the speculum, which is the little instrument to allow us to see the cervix, which is the neck of the womb. So some people don't feel comfortable about that if they've never been sexually active before, but we have fitted in people that have never had sex before, and it's dependent on how you feel about it, but it's completely fine to do.
Okay.
Obviously, an implant doesn't involve any of that because that's just being put in your arm.
Yeah, and of course there's the injection as well, so there are options for people who maybe don't want to have it internally for to begin with.
And there are also other methods of contraception. So there are pills, and there's a patch that you can put on the skin, and there's a ring that you can put in the vagina as well. So there are loads of different types of contraception.
Yeah. So you would, for example, recommend for someone who hasn't maybe been sexually active at all to start with one of those before maybe like jumping to like the internal core, because there's the one that goes in the arm as well. There's the injection, which is a method of LARC.
Yeah, so someone that's never been sexually active might feel happier and more comfortable having an implant put in their arm, which is the little matchstick rod into the arm. But if someone wants to have a coil or IUD and they've never been sexually active, then we can do that as well.
Possible. Brilliant. How much research has been done to decide, how effective LARC really are? Because we need to tell us if we believe it, but what's the statistic? Like, what are the research to back that up?
Statistics show, there's loads of studies that show that they're very, very effective. So they're the risk of pregnancy is much less than 1% with the IUDs and coils and the implants. It's a very, very small risk. Yeah, they're very effective.
So that's incredible, right?
No method is perfect. So we always would tell you that there's a tiny risk of pregnancy, and it's always important that you know that. But actually, if you're using a LARC method, you're very unlikely to get pregnant. And that is different to using a condom for contraception. They do have a lot of protection, but not as much, not as effective.
Yeah, especially when it comes to pregnancies. When it comes to, talking about reproductive health, naturally there are like religious and cultural conversations that come around it. What are some of like the cultural sensitivities and religious sensitivities around prescribing, LARC for young women from different backgrounds?
Yeah, so anyone from any culture or any religion is welcome in our clinics and can use LARC methods. So there's no restrictions at all. I guess the thing that you might need to think about is if you're having sex and that's taboo in your culture or in your religion, then you may prefer to use a method that when you go home, your mum or other members of your family can't see. So you might not want an implant that sometimes is just visible in your arm, for example. You might want something that can't be seen. And then just the other thing is that the IUD or coil can sometimes work after the egg is fertilized, and some people prefer to not use a method that acts after fertilization.
Yeah, okay, that makes sense. Another question that came in was a young person was asking if the implant can give them hormonal imbalances and them getting spots, and they're quite worried about what that means for their skin. What would you say, like what advice would you give young people that are worried about the hormonal imbalances that come with contraceptives?
So any hormonal method can have some side effects. For most people don't get side effects with them. So, for example, the implant has a progesterone hormone in it, and that can for some people, just a small number of people, can slightly increase your risk of things like headaches or acne spots or breast tenderness or changes to your mood. But most people don't get those. If you do find that you're someone that gets side effects, then there are methods that don't have hormones, so like the IUD or copper coil, and that could be an option for you instead.
Another question that we had come in was a young lady asking or saying that her aunt had the LARC implant and she got pregnant anyway, and she wants to know why this happens, because understandably she's now a little bit worried about its effectiveness.
I mean, I think if we go and talk to enough people, we'll always find people where something hasn't worked or they haven't liked it or something's gone wrong. And like I said, nothing is perfect. So there is a tiny risk of pregnancy, but actually the implant is, apart from not having sex at all, the implant is our most effective method of contraception. And it's, like I said, much less than 1% chance of getting pregnant with it. If someone does get pregnant with the implant, the most common reason is actually that they were already pregnant with a very early pregnancy when it was put in. So that's why it's really important when you have these methods fitted that you don't have a risk of pregnancy at the time of fitting.
Yeah. Another question that we had was quite similar to that as well in terms of side effects. And this young lady said her brother's girlfriend had to remove an implant because it was making her put on weight. Is that a regular side effect that most LARC treatments have, or is that just one of those anomalies that tend to happen?
So we have lots of people that come into our clinics that blame putting on weight as due to their contraception, but actually if you look at the studies, the only method that really makes you put on weight is the injection. So that does have a small weight gain with the injection, the one that you have every 13 weeks or so. But if you look at the other methods, there's no evidence. So the IUD or coil or the implant or even the pills that we talked about, there's no evidence that they actually make you put on weight.
Okay, well, that's good to know. I hope that they're listening. We're going to go for a quick musical break. And when we come back, we're going to pick up. But our key sexual health message for this show is that sexual health relationships matter. And we encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on STIs to sexual partners. Condoms are the best way to protect yourself against STIs and can also protect against unplanned pregnancy. Haringey have a free Pan London scheme, hashtag Come Correct. Once you register, you can access free condoms across London wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey.
Sexual Health Unwrapped, the ins and outs, a 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.
Hello and welcome back to Unity Xtra. You were just listening to Made You Look by Megan Trainor. You are listening to the Sexual Health Ins and Out program. Sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, both of which are asymptomatic. That means you have no symptoms, but you can still pass on STIs to your sexual partners. Condoms are the best way to protect yourself against STIs and can also protect against unplanned pregnancies. Haringey have a free Pan London condom scheme, hashtag Come Correct. Once you register, you can access free condoms across London wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey. So we still have Dr. Rachel on the line, and we are talking about reproductive and sexual health. So when people go in, understandably, they have lots of concerns. We just want to sort of delve into some of those concerns, such as information when someone comes into the clinic and they have a consultation. How long is the information kept at the clinic?
So legally, we have to keep your information for a minimum of 8 years after the last time that you visited us. But actually, if you're under 25, then it's at least until you're 25 years old as well.
Okay. I mean, the information is confidential anyway, just for listeners who are not sure, your information isn't going to be shared with anyone. I think it's been kept for their own safety and so that there's a history if they ever need to be treated in the future.
Yeah, so everything that we any information we take from you, we keep confidentially. Absolutely. The only time we would break your confidentiality is if we were concerned that you were at risk, at significant risk, or someone else was. And if we were ever going to break your confidentiality, we would always aim to talk to you first and let you know. So we wouldn't just go behind your back and give information to anyone else. So we're not giving your information to your GP or to your parents or family or anything like that.
Okay. We also received some questions, this time mostly around sex and reproductive health. So I'm just going to get into some of those as well. A young lady has asked if she can get pregnant the first time that she has sex.
Yes, you can get pregnant the first time you have sex. So it's really important that you plan ahead and use contraception before you start having sex. And at a minimum, if you're having sex when you haven't thought about it before, make sure you use a condom because that will protect you against an STI, but also hopefully make it much less likely that you would get pregnant.
Yeah. If someone isn't sexually active, what do they need to know about, sexual health services in the borough?
Well, I think it's always good to know what services are available, even if you don't need them quite yet. But as we've said, it's really good to plan ahead as well. So if you're thinking about having sex, then come into one of our clinics and we can talk to you about the options for contraception. And like we said, you can have something fitted before you start having sex so that you're protected right from the beginning.
Yeah. Can people still have sex and get pregnant whilst on their period?
Yes, especially if your periods are quite long or they're quite close together. Actually, the time you're most likely to have sex is leading up to the middle of your cycle. But you can get pregnant any time in your cycle, and particularly if your periods are irregular, then it might be difficult to know exactly when you'll get pregnant. So it's always good to use contraception for sex any time of your cycle.
Okay. If someone has an STI, what kind of treatment can they get if they want to be sexually active? And how long would that kind of treatment last for?
Okay, so it depends what the STI is that you're having treated. So you said earlier the most common infection is chlamydia, and then gonorrhea is one of the others. And chlamydia is treated really easily with some tablets, which you usually take twice a day just for a week. But different infections will be treated slightly different ways. Gonorrhea we would normally treat with an injection because that's the best treatment for that. So for most STIs, they're very easily treated with antibiotics, and it's really important that you get treated early, because if you leave infections, and you said sometimes you can have infections without having any symptoms, that's why it's good to get tested and checked. But if you leave an infection, then that can cause damage, whereas if you have it treated straight away, then you're much less likely to get any damage. Of course, there are some infections, so HIV is the obvious one where treatment is for life, and that's why it's so important to protect yourself by using condoms every time you have sex and reducing your risk of getting any STIs.
Yeah, that makes sense. I mean, another question that we got was, why should I go to a sexual health clinic to find out about STIs when I could go online and look it up myself? I think this is one that came up quite often.
Yeah,
because most people are like, I can find out online. Why do I need to go into the clinic for?
And it's good. There's lots of really good information online. I mean, make sure you go to a good website. So SexWise is a great website to look up if you want to know more about STIs and contraception, and all the LARC methods are there. But also there's loads of myths and stuff that's not true online, particularly if you're going to quite unreliable sources. So the advantage of coming to a clinic is you can ask the questions that you want and get answers straight away. And if there are things you're worried about, you can talk about those things. Or if you come to a clinic, obviously you can get tests for STIs, and you can get your contraception, and you can get condoms. So there's lots of extras that you get from coming to a clinic compared to just looking online.
Yeah. And another question that came in was, can I get an STI if it's my first time having sex? I feel like this links right well with the can I get pregnant whilst having sex for the first time?
Yes, and absolutely you can. And you talked about someone who got pregnant, got HIV for the first time that they had sex. So that's unlikely, but it can happen. So important, as we've said, always to use a condom to provide that protection. And actually, if you're with someone and they're not willing to use a condom, then you can say no to sex. You don't have to have sex with them. So it's your choice. You should feel empowered to say no to sex if you don't want to have it, or if someone's not prepared to use a condom.
Yeah, that makes sense. I mean, I completely agree with that. Another question that came up was, I know a lot of young guys and girls my age, 18 and upwards, who have never been to a sexual health clinic in their life, and they are sexually active. Is that a bad thing?
Yeah, they should come and see us. As we've said, it's really good to get a regular STI screen if you are having sex. As we've said, we're here for anyone. So if you are having sex, it's good to have a regular STI screen. And you also obviously can come and talk to us about contraception. You can get condoms from our clinics as well. So yes, it's good. Come and use us. You know where we are, Moreham House and Lordship Lane. And like I said, we've got the walk-in clinics if you're under 19 on the Tuesday and Thursday between 4 and 7 as well.
Brilliant. I feel like that's a really good point to take a quick musical break, and then we will be right back. The key message here is that sexual health is important, and it's important to say something to someone who is trusted and a professional. Sexual health relationships matter. We encourage early and regular testing, as data shows that the most common contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms but are still infectious and can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and can also protect against unplanned pregnancy. Haringey have a free Pan-London condom scheme, #ComeCorrect. Once you register, you can access free condoms across London wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey.
Sexual Health Unwrapped, the ins and outs, a 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.
Hello and welcome back. You are listening to Cuff It by Beyonce. You're listening to the ins and out of sexual health. It is important, so it's important to say something to someone who is trusted and a professional. Sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and can also protect against unplanned pregnancies. Haringey have a free pan-London condom scheme, #ComeCorrect. Once you register, you can have access to free condoms across all of London, wherever you see the ComeCorrect window sticker. Please go to your local pharmacy in Haringey. So before we went on the break, we're talking about, whether you can have STIs or unplanned pregnancies, for the first time having sex. I think now I want to get in a little bit deeper and just kind of encourage young people as to why they should know about it. Why is it important for young people to learn about reproductive health? Because this isn't just about safe sex. It's also about their reproductive health. Why would you say it's important for them to learn about it?
I think it's really important for us to understand how our bodies work. And that helps us to be able to avoid STIs and an unwanted pregnancy, but also for us to be able to maximize our sexual health and to be as healthy as we can.
Yeah, I agree. And I think one of the things of sexual health as well, or one of the things in this show that we're also trying to drive at, is the fact that it's open and accessible to anyone and everybody. And hopefully that can help sort of destigmatize it, because people are worried, young people are worried about if they will be judged if they see a young girl going to a reproductive clinic, for example. So what would you say to somebody like that who's worried about how they're going to be seen or perceived going into a clinic?
Yeah, so we actively encourage young people to come to our clinics. Certainly the staff that we have in our clinics won't be judging you at all for coming. We're actively wanting you to come and see us. Even if, like we've said, you're not sexually active yet, but you've just got some questions or you want to plan ahead, then just come in. If you want to come into the drop-in clinics that I talked about on Tuesday and Thursday after school, then that's a time when you know that most of the people there are going to be young people anyway. Obviously, there's always some people that make judgments about us, but you won't be judged if you come to the clinic, not by our staff anyway.
That's brilliant. Who can young people speak to in Haringey about their concerns and fears about reproductive health?
So you can, as I said, come to any of our clinics. We've got great nurses working in our clinics, but you can also see your GP, or you might have a school nurse that you can talk to. If you're going to a youth club, there might be one of the youth workers that might be able to give you some advice, but they would usually want to signpost you to someone who knows a bit more about STIs and contraception. But there's always people that you can go to and ask. And it's fine just to come into our clinics just if you've got questions that you want to find the answers to.
Yeah, speak to somebody about. We had a couple of questions come in as well, and some of these are kind of tied together. So I think we mentioned this earlier on in the show, but somebody asked how confidential is the information when they visit a sexual and reproductive health clinic, and will their family know that they visited a clinic for a checkup, as an example?
Yeah, no, so all the information that we keep about you is completely confidential. So we're not sending it off to your GP or passing it on to your mum or family or whoever. The only time that we break your confidentiality is if we are worried that you're at significant risk of harm, or if someone else that you've told us about is at significant risk of harm. And that would be the only time that we would then need to talk to someone else. And we would only talk to the people that we absolutely need to. And we would always try to talk to you first. So we would always let you know. So you wouldn't just find that we'd gone off and talked to someone else without talking to you about that at all first.
Yeah. So your confidential information is completely safe. There is no judgment from the clinic. All the doctors in the clinics are professionals. They do this day in, day out. So you are completely safe. I want to say thank you so much to Rachel. But just before I wrap up the show, I have one last final question. So we're talking about luck and luck being, ahead, you plan ahead. But let's say someone hasn't planned ahead, for example, and they've gone and slipped up and now they need emergency contraception. How effective is that? Just so we know the importance of planning ahead versus, how effective is contraceptives? Because that tends to be the second point or the second option that people go for, or some people even use it as a preventative method, but they have emergency after they've had sex. How effective is that?
Oh, so it's not as effective as planning ahead and using regular contraception. I think the thing I'd say is if you have had sex and you haven't used contraception, seek help as soon as you can. And there are tablets that you can take that are to have some effect at reducing the risk of you then getting pregnant. The best emergency contraception is to have the coil or IUD that we've been talking about, the same one that we use as an ongoing method. And that's actually really effective if you have that fitted. And often you've got a few days after the sex. So like I say, come straight away. But sometimes there is a bit of time to be able to fit that and put it in. And then you've got that IUD, you can carry on using that for up to 10 years. So not only have you then got something that's very good for the emergency situation, but also as an ongoing method of contraception. So I think the bottom line, as we've said, is try and plan ahead. Come and try out the LARC methods because they are much more effective than condoms. They're easily accessible. Yes, everything has its tiny risks and there are side effects, but for most people, they're really, really good options. So come and talk to us about them. There's more information on our website. There's information on SexWise. There's information on the Haringey Council website as well. And there's loads of information that is good information out there. But come and talk to us. Come and ask us your questions. Come and get your STIs tested, treated, and contraception on board.
Brilliant. Thank you so much, Rachel. It's been an absolute pleasure. I even picked up a few tips here and there. So I hope that to all of our listeners, I hope that this was really helpful. If you have any questions, of course, you can contact the radio station at info@unityxtra.com. But of course, you can also contact any of our professionals throughout any of the shows that you listen to. The ins and outs of sexual health are important. So it's important to say something to someone who is trusted and a professional. Sexual health and relationships matter, and we strongly encourage you to get early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and can also protect against unplanned pregnancy. Haringey Council have a free pan-London condom scheme, #ComeCorrect. Once you register, you can access free condoms across London, wherever you see the ComeCorrect window sticker. Please go to your local pharmacy in Haringey. Once again, thank you so much to Dr. Rachel DeSouza, and thank you to all of our listeners. I will see you next week. We're going to close out with a song. Enjoy.
Sexual Health Unwrapped, the ins and outs, a 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.